With a safe housing program that was actually discriminating against tenants. That's the allegation against Anoka, coming from the U.S. Department of Justice this week, after the U.S. Department of Justice says the city's crime-free housing program discriminates against tenants with mental health disabilities. The city's website says crime-free housing is a partnership between law enforcement, rental owners and managers, and residents. The goal? Reduce crime, drugs, illegal, and nuisance activity in rental communities. But the DOJ is saying right now that the city often considered mental health 911 calls nuisance activity and then shared details of those calls and held them against both the tenants and the landlords. The letter saying all of this is detailed and eye-opening. But Kent, let's start with the basics. A lot of cities have these crime-free housing programs since the early 90s. So how did this one come under this light?
Well, it started, Jana, after multiple people with mental health disabilities came forward, and then landlords also came forward. And after wrapping up the investigation, the assistant U.S. attorney compared the crime-free housing program in Anoka to a scheme that callously targets people, she said, with disabilities and their loved ones by penalizing them simply for calling 911 in times of need.
Anoka city officials are still working on their response to a scathing letter from the Department of Justice finding that it violated the Americans with Disabilities Act and the Fair Housing Act by denying tenants with mental health disabilities an equal opportunity to receive emergency assistance.
Reading that report just infuriated me.
Sue Abderholden with the National Alliance on Mental Illness Minnesota chapter points to issues raised by both tenants and landlords. According to the letter, from at least 2018 to this year, Anoka sent weekly reports to all landlords in the city detailing all calls for emergency service from all rental properties. And those reports often had detailed medical and mental health information of adults and children, including mental health diagnoses, medications, names of medical providers, and even intimate details about suicide attempts. According to the DOJ, mental health calls were more likely to be marked as nuisance calls, adding the city used these calls for service reports to notify landlords of potential issues and encourage them to evict tenants. Evidence also suggests that the city used the reports to encourage landlords to screen potential tenants.
That is just huge to me, and that's incredibly appalling. We have enough people with mental illness who are homeless without the police department trying to push people out.
According to the letter, multiple tenants have reported being evicted because of calls for emergency service related to their mental health disabilities. Tenants and landlords have also reported being deterred from making calls for emergency service because of fears that they will be evicted, fined, or otherwise punished.
And it does take a lot of courage to come forward to someone like the Department of Justice, right, to say this is happening to me and I think it's wrong.
The DOJ is now calling on the city to change its policies and procedures, designate an ADA coordinator, and train staff.
This may not be the end of it, because we have a state law that actually prohibits this very thing from happening, that says that landlords can't evict someone just because they called 911 for an emergency, including a healthcare emergency or domestic violence. And cities aren't supposed to have ordinances that would allow that to happen as well.
How concerned are you that this isn't just happening in Anoka?
I'm very concerned. I'm sure it's happening in other places, but people just haven't come forward. And I guess I would tell them, if this is happening to you, know that you can come forward and actually have something be done about it.
Now, when I reached out to the city of Anoka for comment today, the city manager and city attorneys both said that they have scheduled a meeting to discuss the findings and directives. After that meeting, they said they will be in a better position to respond. In the meantime, Jana, the DOJ is asking anyone else who might have been impacted to reach out. We have that information along with this story on KARE11.com.
I mean, this is the kind of story that just provokes such outrage, because we've tried to do so much work for the last several years to say, if you are going through something in mental health and a crisis, use the phone, call.
Yeah, and Sue said that also underscores the importance of things like 988, not excusing anything that might have been done with 911 calls. But when you call 988, she said that information goes to a specialty area so that those calls are confidential.
All right. Well, we'll stay on this one. Thanks so much, Kent. We appreciate it.